It may seem hard to imagine, but Arizona has been living with coronavirus for nearly a year now. It was this time last year, March of 2020, when the first coronavirus patients started showing up at our Valley hospitals. Tonight, our Mike Pelton is at HonorHealth in Scottsdale with how life has changed for our frontline healthcare workers.
Staff here at HonorHealth Scottsdale Osborn recalling this day 1 year ago as confirmed cases of the coronavirus started to trickle in, filling the hospital with fear and uncertainty.
So much unknown is where I was at personally. It was completely not understanding what this entails.
HonorHealth Scottsdale Osborn Medical Center Director of Nursing Jody Johnson still recalls the first COVID patient that showed up on her unit.
When we found out that, we had the very first patient and that they were truly positive a year ago, there was a lot of fear over going into the rooms and providing the patient care.
Remember all of us with so many unanswered questions on the virus. March 4th, 2020, a turning point.
Employees at HonorHealth hospitals learning a person who tested positive for the coronavirus was treated at one of their hospitals.
One by one, COVID cases becoming all the more prevalent.
One of the biggest challenges is that we didn't know what was coming as an organization or as the campus leadership.
Chief Nursing Officer Benny Klontz.
One of the biggest things that I've learned, I've always known that our staff were resilient, but now I really, really know it.
The staff, frontline workers who've seen too many video call goodbyes.
What's really sad is when the patients know how it's going to end for them too, because they're aware, they've seen it. It happened to maybe 3 of their family members already because they've lost half of their family, and they know, and they say to us, this is it, I may not make it.
Despite all the doctors and nurses trying to find a solution.
I think it's almost a post-traumatic stress that these nurses have, a secondary trauma, and it's a real thing.
As are improving treatments and knowledge of the virus. Of course, there's also the vaccine.
We understand the virus itself better, and our care continues to even get better than it was a year ago. So I'm optimistic.
And ready for anything that shows up in the hospital in the future. In Scottsdale, Mike Pelton, ABC 15, Arizona.